A poison can be defined as any substance which can injure, cause harmful effects in an organism, or even kill an organism. So, this is basically the subject of our lecture and even the subject of this section. In detail, we'll be discussing different poisons. What are the sources for these poisons? Of course, mainly we divide these sources into the animal and the plant sources. But still, the specific sources are discussed over here. Just to give an overview of the type of poisons that can basically kill any organism, and specifically the humans that we're talking about right now. So, whenever we are going to carry out autopsy on any suspected case of poisoning, we get a dead body and we are suspicious that this death was caused by some sort of poisoning. So, what are the type of samples that we are going to send to the chemical pathologist as well as the histopathologist? The tissues are sent to the histopathologist for the slide making. What are we going to look for? Basically, it is the basic or the core knowledge. What are we going to look for in these slides? That is basically the mainstay over here in this section that we are going to discuss. So first of all, the forensic toxicology. We define forensic toxicology as the branch of forensic medicine that deals with the poisons and its harmful effects on the human body. So we'll be dealing with different terminologies of forensic toxicology over here in this first section. Moving on, we'll be discussing the sources and the incidence of the poisoning over here. Now, as I've already told you, they are the animal and the plant sources mainly, but the specific sources are discussed more over and more comprehensively in detail over here in this section. The incidence of poisoning, of course, once the poisoning has taken place, what can basically cause this incidence? It can be a homicidal, it can be a suicidal act, as well as it can be an iatrogenic effect. Iatrogenic is basically normal medications which a person is taking, but its harmful or toxic doses can be dealt in within this toxicology subject. So we'll be discussing the autopsy in suspected poisoning. Autopsy in a suspected case of poisoning is discussed over here whenever we get a case and we're suspicious that this death was caused due to some sort of poisoning. What kind of samples we are going to look for, and the whole autopsy procedure is also discussed over here in this section. So we'll be talking about the forensic toxicology over here. It is basically the branch of forensic medicine that is dealing with the medical and the legal aspects of the harmful effects of chemicals on the human beings. So basically, we're dealing with the medical aspects as well as the legal aspects over here. Legal aspects, of course, depends upon country to country. What are the laws of the country regarding the toxicology? What are the sections of the country? Even depending upon those sections, we are going to deal these toxicology cases. So it depends upon in what country a clinical toxicologist is working on or he's practicing his specialities in. So this is all that we are basically discussing over here in this forensic toxicology subject. Now, as we were discussing the definition for poisons, it's basically any substance which when administered in the living body through any route, it can be an IV, it can be an IM administration, intramuscular that is, and it can be an oral administration, will produce ill health or death by its actions, and which is due to its physical, chemical, or physiological properties. So basically, these are the properties that we are dealing with whenever a poison is administered. We have to look for its physical properties, of course, and its chemical properties. Basically, that is going to determine what kind of chemical reactions this poison is going to take and basically is going to administer when it is going to enter the bloodstream. And the physiological properties, of course, what kind of physiological effects it is going to produce in a human body. So this is basically the definition of poison, and it, of course, we can divide it into acute poisoning. Acute poisoning, it's basically if we administer a poison and it basically manifests its effects in almost 24 hours, it's basically determined as the acute poisoning effects. And then there is chronic poisoning. So if it takes more than 24 hours to basically administer or manifest its effects, it's basically going to come under the discussions of the chronic poisoning. And then we have the subacute poisoning. It's basically somewhere between the acute and the subacute era. It can basically take almost 1 day to administer its effects, and that is going to come under the discussion of the subacute poisoning over here. Then we have the fulminant poisoning. So some of the poisons have such adverse and fatal effects that it is going to be fulminating for the patient and debilitating, and even it can take less than seconds to manifest its effects, and that is going to be a fulminating process, or a fulminant poison is basically the terminology that is used for such a poison. So, as we were talking about the source of poisons and the sources of poisons, of course, it can be some sort of a domestic source. For example, domestic means that we are talking about the household poisons. And household poisons can be even the detergents that we used in our daily life and daily household chores. And even it can be the disinfectants, of course. It can be the cleaning agents that we used in our daily day-to-day work at our houses. And all of these domestic households can be used for the suicide purposes because they're readily available. And if someone intends for the suicidal purposes, then he can basically easily get his or her hands on these types of poisons. And even it can be some sort of an accidental error, because the accidents are usually due to some basically lack of knowledge on part of the children, and children are at stake by poisoning of these domestic items. And antiseptics, they are again of the domestic sources. And insecticides are also used at household basis, and so they can also be included in this level. And rodenticides. So insecticides and rodenticides, both of them can be included in this domestic kind of sources because they're readily available at our homes. And even the children are at stake for accidental poisoning due to these domestic kinds of poisons. So, on the other hand, we have the agricultural and the horticultural poisons. So, agricultural, of course, they are used in the fields and they're readily available in the fields. They can be the farmers who are at stake for these agricultural poisons, or whosoever is basically handling these poisons or administering these poisons in the fields. They are at stake for these kind of sources of the poisons. So basically, the agricultural poisons include the insecticides, and they include the pesticides, the fungicides, the weed killers. They're very common even for the suicidal purposes, for the homicidal purposes. These weed killers and the insecticides or the pesticides are used for the poisoning purposes. Then industrial. So industrial or the agrochemical poisons are basically, they do not have a hard and fast rule between them, and both of them can be intermixed sometimes. So when we're talking about the industrial poisons, it can be any manufactured or produced products of the or even the byproducts of the industries that we are talking about. For example, the organophosphorus poisoning can be really common over here in this industrial type of poisoning. The lead and the phosphorus, all of these are the industrial kind of poisons over here. So whenever we are talking about the commercial poisons, it's basically the storehouses, the distribution centers, and the selling shops that we're talking about. And then we have the drugs and the medicines on the other hand. So basically, it can be a wrong medication which was not prescribed to someone elderly or someone who is below age for that medication, and he has been administered this medication. So it is basically this wrong medication, or even an overdosage by mistake. So barbiturate poisoning is very well known for this, and there is basically a phenomena which is known as barbiturate automatism, and it is basically that the person forgets that he has taken the medicine and he again takes that medicine, and it's basically known as the barbiturate automatism, and it is going to manifest toxicity in that person who is basically overdosing it, who's usually a psychiatric patient. So it can be an over medication, as we were already talking about, and it can be an abuse of drugs. So the drug abuse is one of the highlight over here, and it can cause poisoning because one can basically overdose oneself, and it won't be of a suicidal intention, but he won't be knowing that he's basically overdosed himself. So that will be basically the cause for this overdosage over here by the drug and the medicines. And this basically whole section is also known as the iatrogenic type of poisoning. So this terminology has to be remembered by all of us when we are dealing with this drug and medicine related poisoning. And then we have food and drink kind of poisoning as well, in which preservatives of food grains or other food materials are used, and even they have their own expiration or best before dates that have to be administered or that have to be kept in mind while we are taking these food items. So it's very important just to see whether they are in the best of their conditions whenever we have this intake or not. And then we have the additives. So the additives are usually artificial and they're usually used as a preservative in canned food or tinned food just to basically prolong the shelf life of these materials. And so these additives even themselves can be poisonous at some instances. Moreover, the accidental contamination. So the tinned food is usually contaminated, and it's basically contaminated by the tetanic materials, that is Clostridium tetani is usually the organism behind these tinned materials. So the outer surfaces should be cleaned. It should be in a clean state, and we should really observe whether the tinned food is in a contaminated state or not, because it can really cause poisoning in a lot of cases observed clinically. And miscellaneous drugs, so there are a lot of other miscellaneous categories that could not be included in these categories, but still they are out there, and they have to be kept in mind whenever we are talking about these kind of sources of poisons. For example, the animal poisons can be dealt in with this miscellaneous category, that is the snake bite poisoning, as well as some of the other animals like scorpions, bees. They can be kept in mind, and we have to really administer that these animals are poisonous and their bites can be included in these sources of poisons. So city smoke is another basically cause. It is a polluting cause, and it can cause pollution and even poisoning in a lot of cases. Sewer gases and poisoning, etc. So it's basically the sewerage gases. They are really contaminated and polluting the lungs or the airway of the elderly and the children. So the elderly and the children, the both extremities of the ages are affected by these sewerage gases over here. Now we are talking about the incidence of poison. So when we are talking about it, it's basically whenever we are dealing with a case of poisoning, we should keep in our mind that it can be of a homicidal intent, it can be of a suicidal intent, and it can be of an iatrogenic intent. So these are basically the incidences that we have to keep in our mind. The homicidal is, of course, when we are talking about the murders or some planned deaths by the other people. And the suicide is basically when one person basically kills himself by administering this poison. It's basically a suicidal intent of poisoning. And then we have accidental poisoning that is usually observed in children because they have the lack of knowledge, or in elderly people, or in the drug abuse people, they accidentally overdose themselves, and that is included in this accidental kind of poisoning. And then we have the household poisons. So household poisons can be or cannot be included in this accidental poisoning, and but they are a part and parcel of this poisoning investigations. And then we have the stupefying drugs. So stupefying drugs is basically any drug which is going to alter the consciousness of the person. It is going to be included in the stupefying agents. For example, dhatura and narcotics and all of these, opium, all of these are included in the stupefying kind of drugs. And then we have the aphrodisiacs. So aphrodisiacs are basically the sexual stimulants or party-related drugs. They're all included in these aphrodisiacs. That is basically going to increase the libido in the person who's being affected by the poison. So that is basically the different kind of drugs that are used for the purpose of the poisoning. And then we have the abortifacients. So abortifacients, as the name indicates, it is going to basically deal with only those poisons which is going to cause abortions in pregnant females. So they're going to be included in this section of this abortifacients, and that basically includes the quinine. It can include the ergometrine. Quinine basically causes the synchronism, and ergometrine can also administer a lot of poisoning effects because they are the dosages which are required for causing the abortions are basically very high, and they can cause toxicity on the other hand as well. So they are basically included in this section. And then we have the animal poisons, which include the snake bites, the scorpion bites. All of these are included in this animal poisoning section. And then the fatal doses. So how do you define the fatal dose? It is basically the dose required to cause the death of the person in about half of the experiments that have been carried out. And so this fatal dose is very important for the knowledge of the clinical toxicologist who's working out in the field, and he should be knowing this fatal dose. It is basically the time period from the administration of the drug till the death has occurred. So it's basically the fatal period and the fatal dose that go hand in hand. And then we have the variations in the published fatal poison concentrations. Of course, a lot of deaths occur even below the fatal doses, and in some people this fatal dose is not basically the clear-cut point, and in some incidences it can be a positive or negative effect in a lot of incidences. Now, a lot of tissues are sent to the histopathologist for detailed examination. Whenever we talk about them, it can be a liver, it can be the heart, it can be the brain, and it can be the bile, which is sent to the histopathologist or the chemical examiner who is conducting all these investigations. So the liver is a very important tissue, and it concentrates many poisons. So that is the reason we send this to the histopathologist. And then the heart basically accumulates strychnine and digitalis poisons, and a lot of changes occur in this organ due to these poisonings. And so we are going to send the heart for the strychnine and the digitalis poisoning suspections. And then the brain. Why is the brain sent? It can be the neurotoxic poisons. Whenever we are going to suspect these and the alkaloids, we are going to send the brain to the histopathologist. And then the volatile organic poisons. They are another important group which is basically investigated in the brain primarily. Talking about the bile, it's basically the narcotic drugs, the cocaine, the glutathione, barbiturates, tranquilizers, opium. All of these drugs affect the brain primarily, and they're going to be sent to the chemical pathologist just for the detection of these drugs. So this is basically a very comprehensive review of the tissues and the related drugs that we are suspecting in them. Now, the medical records study before autopsy. Of course, whenever we are going to carry out the autopsy, the medical records, if they are present, they're very helpful. And if any type of treatment was given to the person when he was in the hospital, it has to be observed over here. And then the ante-mortem investigations. Any investigations, if in the ante-mortem state they were carried out, they have to be recorded in the autopsy report as well. The toxicological analysis, if they were carried out, again, they have their own significances. The live samples have their own significances because sometimes there is a delay in the performance of the autopsy and the collection of the samples after the death has taken place. So the live samples are again very important over here, and there should be a complete history of the person you are performing the autopsy on. Then the ante-mortem blood or the urine samples are again very important over here, and they have to be sent to the histopathologist when after the collection, and the time should be noted along with these blood and the urine samples whenever they are taken. So in this section, basically we gave an overview about the forensic toxicology. How are we going to deal with the case of suspected poisoning, and what are the samples that we are going to take? What is the significance behind these samples, and how is the histopathologist going to examine these samples? All of this is discussed over here. That is the end to this section. Thank you for watching sqadia.com.